file before us today is dealing with a subject that we've heard about in this chamber a little bit, and that has to do with drugs and drug diversion. Drug diversion is really the theft of controlled substances, most commonly opioids, in our healthcare institutions. And that can look a lot of different ways. It can be unopened vials of substances like fentanyl being stolen. It could be that those vials are tampered with and the controlled substance is taken out and it's substituted with other substances like saline solution, or it could be diluted, or it also could involve patients only being given part of the controlled substance, that drug that was prescribed for the patient's health, but only the patient gets a portion of it instead of all of it. It also can involve the sharps containers and getting the syringes out of those sharps containers in order to get the residual products in that. And the problem is, this is really tightly coupled with the increase in opioid addiction in our society. There were about 4 billion prescriptions filled in 2010. And the most common medicine that was prescribed were these opiates. And they're highly effective, but they're also highly addictive. It's kind of like when a good drug goes bad. And we've had ample examples of that, and that's why we have the bill before you today. For example, in Denver, Colorado, you might have remembered reading about an infected healthcare worker who, in the process of diverting narcotics for himself, also passed on hepatitis C to approximately 36 patients. We also have in Minnesota here, in St. Cloud, we had a healthcare worker who was stealing intravenous drugs from 25 patients and replacing them with salt water in their IV bags. 6 patients were infected with a rare bacteria, and 1 died. In 2011, a former nurse at Abbott Northwestern Hospital was charged with stealing painkillers intended for a surgery patient and then telling him that he needed to man up during the painful kidney stone removal because he couldn't have any more medication. And we see example after example like that. The one that caught my attention was in 2011, and this was the case of Gerald Mullins, who stole medicine from a hospital where he worked. He went to drug treatment, came back to the hospital, stole patient drugs again, went to treatment again, and came back to the hospital again. This happened 3 times. And yet the problem was the licensing board never knew about it until 15 years. This had been going on for 15 years. And having these medical drug thieves is very dangerous to our patients. It goes just exactly against what is in the best interest of the patients. In one example, I think this probably is the most creative example, if there's such a thing. There was a nurse who was administering opiates and sedatives to patients during colonoscopies, and it was found that she had a secret pocket sewn into her uniform top so that she could drop the syringes of the potent opioid fentanyl, and then she substituted them with syringes containing saline solution. These type of things are why we have the bill before us today. We also have an example where a patient was undergoing a surgical procedure. This was here in Minneapolis. And a nurse took most of the prescribed dose of fentanyl for herself, leaving the patient in agonizing pain and telling him to man up because he could not be given any more pain medication. So I will just tell you one more example, and then I'll kind of give you a number that might kind of put it all in perspective. And it's not just Minnesota members. One of the hospital managers of controlled substance surveillance at the University of Tennessee Medical Center in Knoxville recently said, "I was catching at least one healthcare provider every month stealing medication." And recently we have found that just 4 drug-diverting healthcare workers exposed 30,000 patients to the risk of hepatitis C. This is a serious issue, and that is why we have the legislation before you. And I must thank my co-sponsors, Senator Hayden, Senator Latz, and Senator Rosen, for bringing this before us today. We saw those frightening examples, and the issue is that employers, when they find their employees are diverting patient drugs, which is a felony, they are not required to notify the licensing board, as we saw in the case of Mr. Mullins, for example. And so this legislation just specifically requires that employers do that. Many did report to the licensing boards, but some did not. We are not going to solve this multifaceted problem of opiate addiction and the coupled effect of drug diversion, but this is one small step that we can take to protect patient health and to make sure that those who are addicted to these harmful substances are not just put back into that same high-risk environment again. This legislation is supported by the licensing boards. It is supported by the nursing board, the medical practice board, the pharmacy board. That represents about 79% of those healthcare workers who have gone through the Healthcare Professional Services Program, which deals with addiction. I believe I'm not aware of any opposition. The language has been amended to address all the issues that were brought before us. And I would encourage a green vote for this common sense measure that will help protect patient health. Thank you.